Let's be honest, when most people hear the word surgery, their first fear isn't the instruments or the recovery, it's the anesthesia. What will I feel? Will I wake up during it? Is it even safe? Hi, I'm Dr. Vikram Singh, oral and maxillofacial surgeon, and in this video, let me help you understand the truth about anesthesia in oral surgery, what kinds we use, when we use them, how we keep them safe, because the more you know, the calmer you'll feel walking into the surgical chair. First, let's break the myth. Anesthesia is not dangerous when done properly. It is one of the safest components of modern surgery, especially when administered by trained professionals under proper monitoring. In fact, the risk of untreated dental infections or traumatic injuries are far greater than the anesthesia used to treat them. In oral and maxillofacial surgery, we commonly use two types of anesthesia: local anesthesia and general anesthesia, and sometimes conscious sedation or IV sedation, which sits somewhere in between. Local anesthesia is what we use in most routine procedures like wisdom tooth extractions, biopsies, minor soft tissue surgeries, or dental implants. It works by completely numbing the specific area we are working on. So you'll feel no pain, only some pressure or vibrations. You'll be awake and alert, able to talk and breathe on your own, and go home shortly after the procedure. The anesthetic effect typically lasts for a few hours, and its safety profile is excellent, especially when medical history, allergies, and dosage are carefully reviewed beforehand, which we always do. Now, sometimes patients come in with more complex needs like impacted teeth buried deep in the jaw, facial fractures, jaw correction surgeries, or cases involving extreme dental anxiety or phobia. That's when we consider general anesthesia or IV sedation. Under general anesthesia, the patient is fully unconscious, the airway is controlled, and all vital signs are continuously monitored. This is typically done in a hospital or surgical center, not in a regular dental chair. It allows us to perform longer and more complex surgeries without discomfort or memory of the procedure. But the key is, it is never chosen casually. There's a complete pre-anesthetic workup, blood test, ECG if needed, medical clearance, and the anesthesia is administered by a trained anesthetist or a maxillofacial surgeon certified in deep sedation. Your oxygen saturation, your heart rate, blood pressure, breathing, everything is closely watched, moment to moment. For those who don't need full general anesthesia but still feel anxious, we offer conscious sedation, either orally or intravenously. You're awake but deeply relaxed. You may not remember much, and you won't feel anxiety or pain. It's especially useful for children, patients with special needs, or adults with dental phobia. Even here, safety is paramount. We monitor vitals, use precise dosage, and ensure you're never left unattended. Now let's talk about safety, because that's what matters the most. Anesthesia in oral and maxillofacial surgery is tailored to you. There is no one-size-fits-all plan. We evaluate your age, your weight, medical history, allergies, medications, and even past surgical experiences. We use single-use syringes and drugs stored in temperature-controlled environments. Emergency equipment like oxygen, suction, and resuscitation kits are always within arm's reach. Our team is trained in life support protocols, and we rehearse emergency drills regularly, not because we expect problems, but because preparation is part of professionalism. There's a quote I often tell my patients: anesthesia is not the absence of awareness, it's the presence of trust. And the trust is built when the patient knows exactly what will happen, when and why. That's what we believe in. If you are someone preparing for oral surgery and you're nervous about anesthesia, let me say this: fear is normal, but fear without facts leads to unnecessary stress. So ask your patients, discuss your concerns openly, because once you understand how carefully anesthesia is planned, monitored, and personalized, you'll realize that safety isn't just a promise, it's a protocol. Thank you for watching, and if this video helped you feel more informed about the anesthesia in oral surgery, please share it. Someone else might be sitting on the same doubt right now. And if you have more questions, leave them in the comments. I'll take them up in the future videos, because the more you know, the better you heal.